Question 1. What is the single most critical step a phlebotomist should perform before collecting a blood specimen? A. Gathering all necessary equipment. B. Washing their hands thoroughly. C. Accurately identifying the patient. D. Explaining the procedure to the patient. Answer: C. Accurately identifying the patient. Explanation: this question addresses the fundamental concept of patient safety in phlebotomy, with most critical step emphasizing its foundational importance. Accurately identifying the patient ensures that the correct tests are performed on the correct individual, preventing potentially life-threatening errors, such as misdiagnosis or incompatible blood transfusions. For instance, if a patient is misidentified, their lab results could be mixed up with another patient's, leading to incorrect medical decisions. Always remember, proper patient identification is the absolute cornerstone of safe and effective blood collection. Question 2. Which of the following is the correct order of draw for a venipuncture using an evacuated tube system? A. Light blue, red, green, lavender. B. Red, light blue, lavender, green. C. Green, red, light blue, lavender. D. Light blue, green, red, lavender. Answer: A. Light blue, red, green, lavender. Explanation: this question tests knowledge of the correct order of draw, which is crucial for preventing additive cross-contamination and ensuring accurate test results. The standard order of draw for common tubes is typically blood culture, sterile, light blue, coagulation, red/gold/tiger top, serum, green, heparin, lavender/pink, EDTA, and gray, glucose. Following this specific sequence, often remembered by mnemonics like stop light red stay put green light go, ensures that additives from one tube do not interfere with tests in subsequent tubes. For example, EDTA from a lavender tube could falsely lower calcium levels if drawn before a serum tube. Adhering to the order of draw guidelines is vital for maintaining specimen integrity and laboratory accuracy. Question 3. A phlebotomist is preparing to draw blood from a patient and notices the patient is wearing a Do Not Resuscitate (DNR) wristband. What is the phlebotomist's responsibility in this situation? A. Refuse to draw blood as it might violate the DNR order. B. Proceed with the blood draw as it is a routine procedure unrelated to resuscitation. C. Contact the patient's nurse or physician to confirm the order. D. Ask the patient if they still want the blood draw. Answer: B. Proceed with the blood draw as it is a routine procedure unrelated to resuscitation. Explanation: this question assesses understanding of ethical boundaries and a phlebotomist's role concerning patient orders like DNR. A Do Not Resuscitate (DNR) order specifically pertains to medical interventions meant to revive a patient whose heart or breathing has stopped, not routine medical procedures like blood draws for diagnostic purposes. A phlebotomist's role is to collect specimens as ordered by the physician, assuming the patient or their legal representative has given consent for the procedure. Therefore, a DNR order does not preclude routine diagnostic blood collection. Proceeding with the draw, after confirming patient identity and consent, is the correct action unless the patient declines. Question 4. After performing a venipuncture, the phlebotomist should instruct the patient to apply pressure to the site for how long? A. 1 to 2 minutes. B. 5 to 10 minutes. C. 3 to 5 minutes. D. Until the bleeding stops. Answer: C. 3 to 5 minutes. Explanation: this question is about proper post-venipuncture care, a crucial step for patient safety and comfort. Applying pressure to the venipuncture site for 3 to 5 minutes helps promote hemostasis, which is the stopping of blood flow, thereby preventing hematoma formation. While pressing until bleeding stops might seem intuitive, the specific duration of 3 to 5 minutes is the standard recommended time for most adult patients, allowing sufficient time for clot formation without excessive pressure. For instance, if pressure is not applied long enough, blood may leak out of the vein and collect under the skin, forming a painful bruise called a hematoma. Always ensure adequate pressure is applied to prevent complications and ensure patient well-being. Question 5. Which needle gauge has the largest lumen? A. 23 gauge. B. 21 gauge. C. 18 gauge. D. 25 gauge. Answer: C. 18 gauge. Explanation: this question tests knowledge of needle gauges, a fundamental concept for selecting appropriate equipment for venipuncture. In the gauge numbering system, a smaller number indicates a larger needle lumen, the hollow bore through which blood flows. Therefore, an 18-gauge needle has a significantly larger opening compared to a 21, 23, or 25-gauge needle. For example, an 18-gauge needle is typically used for blood donations due to its large lumen, which allows for faster blood flow and less damage to red blood cells. Always remember that a smaller gauge number means a larger needle opening. Question 6. What is the primary purpose of a tourniquet in venipuncture? A. To prevent blood from flowing back into the patient. B. To make veins more prominent and easier to palpate. C. To sterilize the skin before insertion. D. To reduce pain during the blood draw. Answer: B. To make veins more prominent and easier to palpate. Explanation: this question assesses understanding of the basic function of a tourniquet in venipuncture, a key tool for successful blood collection. The primary purpose of a tourniquet is to impede venous blood flow temporarily, causing blood to pool in the veins below the tourniquet. This pooling makes the veins engorged, more visible, and easier for the phlebotomist to palpate, feel, and stick. For example, without a tourniquet, many veins might be too small or too deep to locate reliably. Proper tourniquet application is essential for successful vein access, but remember to release it within 1 minute to prevent hemoconcentration. Question 7. A phlebotomist must verify a patient's identity using at least how many unique identifiers? A. 1. B. 2. C. 3. D. 4. Answer: B. 2. Explanation: this question emphasizes the critical safety protocol of patient identification, a cornerstone of preventing medical errors. Healthcare standards mandate using at least 2 unique patient identifiers before any procedure, including blood collection, to ensure the right patient receives the right care. Common identifiers include the patient's full name, date of birth, and often a medical record number or unique identification number. For instance, simply asking, "Are you John Smith?" is insufficient because multiple patients might share the same name. Instead, confirming name and date of birth significantly reduces identification errors. Always prioritize patient safety by meticulously verifying identity using the 2-identifier rule. Question 8. Which of the following is the most common antiseptic used for routine venipuncture? A. Iodine. B. Hydrogen peroxide. C. Isopropyl alcohol. D. Chlorhexidine. Answer: C. Isopropyl alcohol. Explanation: this question focuses on the essential infection control practice of skin preparation before venipuncture. Isopropyl alcohol is the most widely used and recommended antiseptic for routine venipuncture due to its effectiveness in reducing surface bacteria and its rapid evaporation. While other antiseptics like iodine or chlorhexidine are used for special procedures like blood cultures, isopropyl alcohol is generally sufficient for standard blood draws. For example, cleaning the skin with an alcohol wipe in a circular motion, moving outwards from the puncture site, effectively minimizes the risk of introducing skin bacteria into the bloodstream. Always allow the alcohol to air dry completely before needle insertion to ensure its antiseptic action and prevent stinging. Question 9. A patient experiences syncope, fainting, during a blood draw. What is the phlebotomist's immediate priority? A. Continue the blood draw quickly. B. Call for a nurse immediately. C. Remove the needle and apply pressure to the site. D. Elevate the patient's feet. Answer: C. Remove the needle and apply pressure to the site. Explanation: this question addresses patient safety and managing common complications during venipuncture. When a patient faints, the immediate priority is to ensure their physical safety by removing the needle to prevent injury from movement and then applying pressure to the site to stop bleeding and prevent a hematoma. Only after securing the puncture site and ensuring the patient is safe should other interventions like elevating the feet or calling for assistance be considered. For example, if the needle remains in the arm, sudden patient movement could cause a serious laceration. Always remove the needle and apply pressure first to prevent further harm. Question 10. When drawing blood for a blood culture, what is the most critical aspect of the collection procedure? A. Using a large gauge needle. B. Collecting a large volume of blood. C. Performing meticulous aseptic technique. D. Drawing from an artery instead of a vein. Answer: C. Performing meticulous aseptic technique. Explanation: this question highlights the paramount importance of infection control for blood cultures, which are used to detect bloodstream infections. The most critical aspect is meticulous aseptic technique, meaning strict adherence to practices that prevent contamination, including thorough skin disinfection and not touching the prepared site. Contamination of a blood culture specimen with skin bacteria can lead to a false positive result, causing unnecessary treatment or delays in correct diagnosis. For example, a contaminated specimen might show growth of common skin flora, leading the doctor to think there's a serious infection when there isn't one. Always remember that preventing contamination is the key to accurate blood culture results. Question 11. Which blood collection tube is used for a complete blood count, CBC? A. Light blue top. B. Red top. C. Lavender top. D. Green top. Answer: C. Lavender top. Explanation: this question tests knowledge of common lab tests and their corresponding tube types, which is essential for accurate specimen collection. The lavender top tube contains EDTA, ethylenediamine tetrashic acid, an anticoagulant that preserves cell morphology and prevents clotting, making it ideal for hematology tests like a complete blood count, CBC. A CBC measures various components of the blood, such as red blood cells, white blood cells, and platelets. For example, using a red top tube for a CBC would cause the blood to clot, rendering it unsuitable for cellular analysis. Always remember that lavender tops are for CBCs and other whole blood hematology tests. Question 12. A phlebotomist should never recap a needle after venipuncture. This practice helps prevent A. Hemolysis. B. Hematoma. C. Accidental needle stick injury. D. Vein collapse. Answer: C. Accidental needle stick injury. Explanation: this question focuses on a crucial aspect of phlebotomy safety, preventing needle stick injuries. OSHA, Occupational Safety and Health Administration, guidelines strictly prohibit recapping needles after use because it carries a high risk of accidental self-puncture, potentially exposing the phlebotomist to bloodborne pathogens. Instead, used needles should be immediately disposed of in a puncture-resistant sharps container. For instance, attempting to recap a needle with two hands often results in missing the cap and sticking oneself. Always activate the needle's safety mechanism and discard it directly into a sharps container to protect yourself and others from harm. Question 13. Which of the following is an example of an appropriate site for dermal puncture in an adult? A. Tip of the index finger. B. Central fleshy pad of the middle finger. C. Earlobe. D. Thumb. Answer: B. Central fleshy pad of the middle finger. Explanation: this question pertains to the correct selection of dermal puncture sites, which is vital for patient safety and obtaining adequate specimens. For adult dermal punctures, the preferred sites are the fleshy pads of the middle or ring finger of the non-dominant hand. The tip of the finger, thumb, or index finger should be avoided due to thinner tissue, more nerve endings, or increased bone proximity. For example, puncturing the tip of the finger could cause pain and lead to inadequate blood flow. Always aim for the lateral or medial aspects of the fleshy pad of the middle or ring finger to ensure a safe and effective collection. Question 14. What is the proper angle of needle insertion for a routine venipuncture? A. 10 to 15 degrees. B. 25 to 30 degrees. C. 45 degrees. D. 90 degrees. Answer: A. 10 to 15 degrees. Explanation: this question tests a fundamental technique in venipuncture, the correct angle of needle insertion. For a routine venipuncture using an evacuated tube system, the needle should be inserted at a 10 to 15 degree angle with the bevel facing upward. This shallow angle allows for smooth entry into the vein, minimizing the risk of going through the vein or damaging surrounding tissue. For instance, inserting at too steep an angle might cause the needle to pass completely through the vein, resulting in a hematoma, while too shallow an angle might prevent penetration. Always ensure the bevel is up and the angle is shallow to ensure proper vein access. Question 15. A patient has an 4 infusion running in their right arm. Where should the phlebotomist draw blood from? A. Below the 4 site in the right arm. B. Above the 4 site in the right arm. C. The left arm, if suitable veins are available. D. The leg or foot, as a last resort. Answer: C. The left arm, if suitable veins are available. Explanation: this question addresses a common clinical scenario and the importance of avoiding compromised sites for blood collection. Drawing blood from an arm with an 4 infusion can lead to inaccurate test results due to dilution of the specimen with the 4 fluid. The preferred site is always the opposite arm if it has suitable veins. If the opposite arm is also compromised, then below the 4 in the same arm, after the 4 has been shut off for at least 15 minutes, may be an option, but the arm without an 4 is always first choice. For example, drawing from the same arm as an 4 might cause the sample to show falsely low electrolyte levels. Always prioritize collecting blood from an 4-free arm to ensure specimen integrity. Question 16. Which additive prevents blood from clotting by binding with calcium? A. Heparin. B. EDTA. C. Sodium citrate. D. Sodium fluoride. Answer: B. EDTA. Explanation: this question focuses on the mechanism of action of common anticoagulants used in blood collection tubes. EDTA, ethylenediamine tetrashic acid, found in lavender and pink top tubes, prevents clotting by chelating, binding with calcium ions, which are essential for the coagulation cascade. Without free calcium, the blood cannot clot. For instance, if you need a whole blood specimen for a CBC, EDTA is the additive of choice because it preserves the cellular components without allowing them to clot. Understanding how different additives work is crucial for selecting the correct tube for specific tests. Question 17. The term basal state for venipuncture refers to A. The patient being well hydrated and having eaten recently. B. The patient having rested for at least 30 minutes before the draw. C. The patient having abstained from food and strenuous exercise for 12 hours. D. The patient being in a sitting position during the draw. Answer: C. The patient having abstained from food and strenuous exercise for 12 hours. Explanation: this question defines a critical patient preparation state for certain laboratory tests. Basal state refers to the body's metabolic state after a 12-hour fast and abstinence from strenuous exercise, ensuring that test results are not influenced by recent food intake or physical activity. This state provides a baseline for accurate measurement of analytes like glucose, cholesterol, and triglycerides. For example, if a patient eats breakfast before a fasting glucose test, their blood sugar levels will be artificially elevated, leading to an inaccurate diagnosis. Always verify fasting requirements with the patient before collecting specimens for basal state tests. Question 18. What is the most common reason for specimen rejection in the laboratory? A. Incorrect patient identification. B. Hemolysis. C. Insufficient quantity, QNS. D. Clotted specimen, for tests requiring whole blood. Answer: B. Hemolysis. Explanation: this question addresses common pre-analytical errors that lead to specimen rejection, which impacts patient care and lab efficiency. Hemolysis, the rupture of red blood cells, is one of the most frequent reasons for specimen rejection. This rupture releases intracellular components into the serum or plasma, which can interfere with many laboratory tests and yield inaccurate results. For instance, a hemolyzed sample might show falsely elevated potassium levels because potassium is abundant inside red blood cells. Proper collection technique, including avoiding vigorous mixing, using appropriate needle size, and not drawing from a hematoma, helps prevent hemolysis. Question 19. A phlebotomist must use standard precautions when collecting blood specimens. What do standard precautions primarily involve? A. Using gloves only for patients with known infections. B. Treating all body fluids as potentially infectious. C. Wearing a mask and gown for every patient. D. Washing hands only after removing gloves. Answer: B. Treating all body fluids as potentially infectious. Explanation: this question highlights the critical concept of standard precautions, which are universal infection control practices. Standard precautions dictate that all blood, body fluids, non-intact skin, and mucous membranes should be treated as potentially infectious, regardless of the patient's diagnosis or perceived infection status. This means consistently using personal protective equipment, PPE, like gloves, and practicing proper hand hygiene for every patient, minimizing the risk of pathogen transmission. For example, even if a patient appears healthy, their blood should still be handled as if it contains a dangerous virus. Always remember that standard precautions are about protecting both healthcare workers and patients from unseen dangers. Question 20. Before performing a venipuncture, the phlebotomist should always ask the patient about A. Their preferred arm for the draw. B. Any allergies, especially to latex or antiseptics. C. Their medical history and current medications. D. If they have ever fainted during a blood draw. Answer: B. Any allergies, especially to latex or antiseptics. Explanation: this question focuses on essential pre-draw patient assessment for safety. Asking about allergies, particularly to latex, for gloves or tourniquets, or antiseptics like iodine or alcohol, is crucial to prevent adverse reactions in the patient. An allergic reaction could range from a mild rash to a severe anaphylactic response, requiring immediate medical intervention. For example, if a patient is allergic to latex, the phlebotomist must use latex-free gloves and tourniquets. Always prioritize patient safety by inquiring about allergies before selecting equipment or cleaning the site. Question 21. Which type of consent is given when a patient extends their arm for a blood draw? A. Informed consent. B. Expressed consent. C. implied consent. D. Verbal consent. Answer: C. Implied consent. Explanation: this question differentiates between types of patient consent, a key legal and ethical concept in healthcare. Implied consent is given when a patient's actions, rather than verbal or written words, indicate their agreement to a procedure. By extending their arm, the patient is indicating their willingness to proceed with the blood draw. While verbal consent for the specific procedure should ideally precede this, the act itself is implied consent. For example, if a patient offers their arm for a blood pressure reading, they are giving implied consent. Always ensure the patient understands the procedure before they offer their arm. Question 22. What is the typical depth for a heel stick, dermal puncture, on an infant? A. No more than 1 millimeter. B. No more than 2.0 millimeters. C. No more than 2.4 millimeters. D. No more than 3.0 millimeters. Answer: B. No more than 2.0 millimeters. Explanation: this question addresses a critical safety guideline for pediatric phlebotomy, specifically heel sticks on infants. For infants, the puncture depth for a heel stick should not exceed 2.0 millimeters to prevent serious complications like osteomyelitis, bone infection, or nerve damage. The calcaneus bone, heel bone, is very close to the skin surface in infants, making precise depth control essential. For instance, using a lancet that punctures too deeply can hit the bone, increasing the risk of infection and injury. Always use a lancet specifically designed for infant heel sticks to ensure the appropriate depth and safety. Question 23. A phlebotomist is asked to collect a stat blood specimen. What does stat indicate? A. The specimen needs to be collected at a specific time. B. The specimen needs to be collected and processed immediately. C. The specimen needs to be kept frozen after collection. D. The specimen is for research purposes only. Answer: B. The specimen needs to be collected and processed immediately. Explanation: this question tests knowledge of common medical abbreviations related to specimen priority. Stat is a critical medical abbreviation derived from the Latin word statum, meaning immediately. When a blood specimen is ordered stat, it means the collection, transportation, and processing of the sample must be prioritized and completed as quickly as possible due to the urgent nature of the patient's condition. For example, a stat order might be placed for a patient in the emergency room experiencing chest pain to quickly assess cardiac markers. Always treat stat orders with the highest priority to ensure timely patient care. Question 24. Which of the following veins is the first choice for venipuncture in the antecubital fossa? A. Cephalic vein. B. Basilic vein. C. Median cubital vein. D. Radial vein. Answer: C. Median cubital vein. Explanation: this question assesses knowledge of preferred venipuncture sites, a fundamental skill for phlebotomists. The median cubital vein, located in the antecubital fossa, the bend of the elbow, is generally the first choice for venipuncture because it is usually large, well anchored, and less likely to roll. Its position also makes it less painful and reduces the risk of hitting nerves or arteries compared to the cephalic or basilic veins. For instance, if the median cubital vein is prominent, it offers the highest chance of a successful and comfortable draw. Always aim for the median cubital vein first for routine venipuncture. Question 25. What is the purpose of inverting blood collection tubes after a draw? A. To prevent hemolysis. B. To allow the blood to clot quickly. C. To ensure proper mixing of blood with additives. D. To prevent the tube from breaking. Answer: C. To ensure proper mixing of blood with additives. Explanation: this question addresses an essential step in specimen handling after venipuncture. Inverting blood collection tubes containing additives, usually 5 to 10 times gently, ensures that the blood thoroughly mixes with the anticoagulant or clot activator. This proper mixing is critical for preventing clotting in anticoagulant tubes, like EDTA or heparin, or for ensuring complete clotting in serum separator tubes. For example, insufficient inversion of an EDTA tube can lead to microclot formation, making the specimen unsuitable for a CBC. Always invert tubes immediately after collection according to the manufacturer's recommendations to ensure specimen integrity. Question 26. When is the best time to apply the tourniquet during a venipuncture procedure? A. Before palpating the vein. B. After locating the vein but before cleaning the site. C. After cleaning the site and allowing it to dry. D. After inserting the needle into the vein. Answer: B. After locating the vein but before cleaning the site. Explanation: this question focuses on the correct timing of tourniquet application in the venipuncture sequence, crucial for efficiency and infection control. The tourniquet should be applied after selecting the appropriate vein but before cleaning the venipuncture site with antiseptic. Applying it too early might lead to prolonged tourniquet application, hemoconcentration, and applying it after cleaning means you might contaminate the sterile area while tying it. For example, you find a good vein, then apply the tourniquet, then clean the area, and finally perform the venipuncture. This sequence ensures you know where you're going to stick before committing to the sterile field. Question 27. What is the medical term for fainting? A. Vertigo. B. Syncope. C. Hypotension. D. Anemia. Answer: B. Syncope. Explanation: this question tests basic medical terminology commonly encountered in phlebotomy practice. Syncope is the medical term for a temporary loss of consciousness, often referred to as fainting or passing out, which can occur during or after a blood draw. It is usually caused by a temporary reduction of blood flow to the brain. For instance, if a patient reports feeling lightheaded or nauseous during the procedure, they might be experiencing presyncope, signaling a need to lay them down immediately. Understanding this term is important for recognizing and responding to patient reactions. Question 28. Which of the following is an unacceptable reason for specimen rejection by the laboratory? A. Specimen not labeled with patient's full name. B. Specimen collected in the wrong tube. C. Specimen collected from an incorrect patient. D. Specimen collected by a phlebotomist who is in a hurry. Answer: D. Specimen collected by a phlebotomist who is in a hurry. Explanation: this question explores valid reasons for specimen rejection, which are based on objective criteria that compromise specimen integrity or patient safety. A specimen is rejected if it is mislabeled, collected in the wrong tube, or from the wrong patient because these issues directly impact the accuracy and reliability of test results. However, the phlebotomist being in a hurry, while perhaps contributing to other issues, is not a direct, objective reason for rejection by the lab. Rather, the consequences of being rushed, like mislabeling or hemolysis, are the reasons for rejection. Always ensure meticulous attention to detail during collection to avoid any issues that could lead to rejection. Question 29. A phlebotomist enters a patient's room and finds the patient sleeping. What should the phlebotomist do? A. Leave the room quietly and return later. B. Wake the patient gently by speaking their name. C. Wake the patient by shaking their arm gently. D. Begin the blood draw immediately, as the patient is already relaxed. Answer: B. Wake the patient gently by speaking their name. Explanation: this question addresses appropriate patient communication and professional conduct in a healthcare setting. When a patient is sleeping, the phlebotomist should gently wake them by speaking their name to avoid startling them and to allow them to become oriented. It is crucial to obtain their consent and confirm their identity before proceeding with any procedure. For example, simply shaking a sleeping patient could cause them to jump or react defensively. Always prioritize patient comfort and respect their autonomy by gently waking them and explaining your presence. Question 30. What is the maximum amount of time a tourniquet should remain on a patient's arm? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer: B. 1 minute. Explanation: this question highlights a critical guideline for tourniquet application that prevents complications. A tourniquet should remain on a patient's arm for no longer than 1 minute. Prolonged tourniquet application can lead to hemoconcentration, which is an increase in the concentration of cells and larger molecules in the blood, potentially altering test results. For instance, leaving the tourniquet on for too long can artificially elevate protein or potassium levels. Always release the tourniquet as soon as blood flow is established or after 1 minute, whichever comes first, to ensure accurate results. Question 31. Which special handling requirement protects a specimen from light? A. Keeping it on ice. B. Wrapping it in aluminum foil. C. Centrifuging it immediately. D. Storing it in an amber tube. Answer: B. Wrapping it in aluminum foil. Explanation: this question focuses on specific specimen handling requirements designed to preserve analyte integrity. Certain analytes, like bilirubin or vitamin A, are photosensitive, meaning they can break down or degrade when exposed to light. Wrapping the specimen in aluminum foil immediately after collection effectively protects it from light exposure, ensuring accurate test results. For example, if a bilirubin sample is left exposed to light, the results might show a falsely low level, leading to an incorrect diagnosis. Always protect light-sensitive specimens by wrapping them in foil or using an amber-colored tube if available. Question 32. What is the purpose of anchoring a vein prior to needle insertion? A. To reduce patient pain. B. To prevent vein collapse. C. To prevent the vein from rolling. D. To increase blood flow. Answer: C. To prevent the vein from rolling. Explanation: this question addresses a key technique for successful venipuncture. Anchoring a vein involves pulling the skin taut below the puncture site with the thumb of the non-dominant hand. This action stabilizes the vein and prevents it from rolling away from the needle as it is inserted, increasing the likelihood of a successful venipuncture. For example, if a vein is not properly anchored, it might move sideways as the needle approaches, making it difficult to penetrate accurately. Proper anchoring is crucial for precise and effective vein access. Question 33. A patient suddenly complains of sharp, radiating pain during a venipuncture. What should the phlebotomist do? A. Continue the draw, the pain will subside. B. Adjust the needle slightly to find a better position. C. Immediately withdraw the needle. D. Ask the patient to tolerate the pain for a moment. Answer: C. Immediately withdraw the needle. Explanation: this question addresses how to respond to a serious patient complication during a blood draw. Sharp, radiating pain often indicates nerve involvement, which can lead to permanent nerve damage if the needle remains in place. The immediate priority is to withdraw the needle completely to prevent further injury. For example, if a patient reports an electric shock sensation, it's a strong sign of nerve irritation. Always remove the needle immediately if the patient reports sharp, radiating pain, and document the incident. Question 34. What is the common site for a heel stick on an infant? A. The central arch of the foot. B. The posterior curvature of the heel. C. the medial or lateral plantar surface of the heel. D. The top of the foot near the toes. Answer: C. The medial or lateral plantar surface of the heel. Explanation: this question assesses knowledge of safe and appropriate sites for dermal punctures on infants. The medial, inner, or lateral, outer, plantar surfaces of the heel are the recommended sites for heel sticks because these areas have adequate capillary beds and are furthest from major nerves, arteries, and bone, minimizing the risk of injury. Puncturing the central arch or posterior curvature could damage nerves or bone. For example, puncturing too close to the center of the heel increases the risk of hitting the calcaneus bone. Always choose the medial or lateral aspects of the heel for infant dermal punctures. Question 35. Which organization establishes guidelines for phlebotomy procedures, including the order of draw? A. CDC, Centers for Disease Control and Prevention. B. WHO, World Health Organization. C. CLSI, Clinical and Laboratory Standards Institute. D. FDA, Food and Drug Administration. Answer: C. CLSI, Clinical and Laboratory Standards Institute. Explanation: this question identifies the authoritative body responsible for setting standards in laboratory practice, including phlebotomy. The Clinical and Laboratory Standards Institute, CLSI, publishes globally recognized standards and guidelines for various laboratory procedures, including the precise order of draw, specimen collection, and handling. Adhering to CLSI guidelines ensures consistency, quality, and patient safety in laboratory testing. For example, the CLSI document GP41 provides comprehensive recommendations for venipuncture procedures. Always follow CLSI guidelines to ensure best practices in phlebotomy. Question 36. What is the correct way to identify a patient who is unconscious or cannot speak? A. Ask a family member to identify them. B. Rely on the patient's room number. C. Check the patient's wristband and compare it to the requisition form. D. Draw the blood and label it later when the patient is awake. Answer: C. Check the patient's wristband and compare it to the requisition form. Explanation: this question emphasizes the critical importance of accurate patient identification, especially for non-responsive patients. For unconscious or nonverbal patients, the most reliable method for identification is to check their wristband, which should contain at least 2 unique identifiers like their full name and medical record number, and then compare this information to the laboratory requisition form. This prevents potentially fatal errors. For example, relying solely on a family member's identification without cross-referencing a wristband could lead to errors if the family member is mistaken. Always use the wristband as the primary source of identification for non-responsive patients, cross-referencing with the order. Question 37. Which tube additive is used for coagulation studies such as PT and PTT? A. Sodium heparin. B. EDTA. C. Sodium citrate. D. Potassium oxalate. Answer: C. Sodium citrate. Explanation: this question tests knowledge of specific tube additives and their associated laboratory tests. Sodium citrate, found in light blue top tubes, is the anticoagulant of choice for coagulation studies like prothrombin time, PT, and activated partial thromboplastin time, APTT or PTT. It works by binding to calcium, which is essential for blood clotting, thereby preserving the sample's clotting factors in their active state. For example, using a different anticoagulant for PT/PTT could alter the results, leading to an incorrect assessment of a patient's clotting ability. Always ensure the light blue tube is filled to the correct mark to maintain the critical blood-to-additive ratio, 9:1. Question 38. After centrifuging a blood specimen, the liquid portion is called A. Whole blood. B. Plasma. C. Serum. D. Buffy coat. Answer: C. Serum. Explanation: this question distinguishes between different components of a blood specimen after processing. If a blood sample is collected in a tube without an anticoagulant, like a red top tube, and then allowed to clot before centrifugation, the resulting liquid portion is called serum. Serum is plasma without the clotting factors. If the blood is collected with an anticoagulant and then centrifuged, the liquid portion is called plasma. For example, many chemistry tests use serum or plasma, but serum is used for tests where clotting factors would interfere. Understanding this distinction is crucial for proper specimen processing. Question 39. What is the primary reason to avoid drawing blood from a site with a hematoma? A. It is more painful for the patient. B. The blood will be diluted by tissue fluid. C. The sample may be hemolyzed. D. The blood collected from a hematoma can alter test results. Answer: D. The blood collected from a hematoma can alter test results. Explanation: this question addresses a practical consideration for venipuncture site selection. Drawing blood from an area with a hematoma, a bruise where blood has collected under the skin, should be avoided because the collected blood will be contaminated with hemolyzed blood and tissue fluids from the hematoma. This contamination can significantly alter test results, leading to inaccurate diagnoses. For example, drawing from a hematoma could falsely elevate potassium levels or interfere with coagulation tests. Always select a vein in an unaffected area to ensure specimen integrity. Question 40. A phlebotomist must use a winged infusion set, butterfly needle, for venipuncture in which of the following situations? A. When collecting blood cultures. B. For patients with very deep veins. C. For small, fragile, or difficult veins. D. When drawing a large volume of blood. Answer: C. For small, fragile, or difficult veins. Explanation: this question focuses on the appropriate use of specific venipuncture equipment. A winged infusion set, commonly known as a butterfly needle, is specifically designed for venipuncture in patients with small, fragile, rolling, or difficult-to-access veins, such as those found in pediatric, geriatric, or oncology patients. Its small gauge, short needle, and flexible tubing allow for more precise control and less trauma to delicate veins. For example, using a butterfly needle for a hand vein in an elderly patient can prevent vein collapse. Always consider using a butterfly needle when traditional methods are challenging. Question 41. What is the meaning of NPO status for a patient? A. Nothing by mouth. B. No physical activity. C. Normal daily routine. D. Next patient's order. Answer: A. Nothing by mouth. Explanation: this question tests understanding of a common medical abbreviation and patient instruction. NPO stands for nil per os, which is Latin for nothing by mouth. This instruction means the patient is not allowed to consume any food or drink, often in preparation for surgery, certain medical procedures, or specific lab tests like fasting glucose. For example, if a patient is NPO for a fasting blood sugar test, they should not have eaten or drunk anything, except plain water, if allowed, for a specified period. Always verify NPO status with the patient before drawing blood for fasting tests. Question 42. Which potential complication of venipuncture involves damage to the red blood cells, causing them to rupture? A. Phlebitis. B. Hematoma. C. Hemolysis. D. Petechiae. Answer: C. Hemolysis. Explanation: this question directly defines a common pre-analytical error in blood collection. Hemolysis refers to the breakdown or rupture of red blood cells, which releases hemoglobin and other intracellular components into the serum or plasma. This can occur due to various factors during collection, such as vigorous shaking, using too small a needle, or drawing blood from a site with a hematoma. For instance, a hemolyzed specimen often appears pink or reddish, and it can interfere with the accuracy of many lab tests, potentially leading to incorrect diagnoses. Always handle specimens gently to prevent hemolysis. Question 43. What is the proper procedure for applying a bandage after venipuncture? A. Apply immediately over the gauze without pressure. B. Apply after ensuring bleeding has stopped, with the patient holding pressure. C. Apply while the patient is still bleeding to absorb it. D. Apply tightly to create a tourniquet effect. Answer: B. Apply after ensuring bleeding has stopped, with the patient holding pressure. Explanation: this question addresses a critical step in post-venipuncture care, ensuring patient comfort and preventing complications. A bandage should only be applied after verifying that bleeding has completely stopped and after the patient has applied adequate pressure for the recommended duration, usually 3 to 5 minutes. Applying a bandage while still bleeding, or without sufficient pressure, could lead to a hematoma. For example, if a patient removes pressure too soon, the site might start bleeding again, potentially creating a bruise. Always confirm hemostasis before covering the site with a bandage. Question 44. What is the primary purpose of a chain of custody form in phlebotomy? A. To track the phlebotomist's performance. B. To ensure patient satisfaction with the blood draw. C. To maintain integrity and accountability for legal specimens. D. To record the temperature of the specimen during transport. Answer: C. To maintain integrity and accountability for legal specimens. Explanation: this question focuses on the specialized procedure required for certain types of specimens. A chain of custody form is a legal document used to meticulously track the handling and possession of a specimen, particularly for forensic or legal purposes, e.g., drug testing, paternity testing. It ensures that the specimen's integrity has not been compromised and that it has been accounted for at every step, from collection to analysis. For example, without a properly completed chain of custody form, a drug test result might be inadmissible in court. Always understand when chain of custody is required and follow its strict protocols. Question 45. What is the most common potential complication if a phlebotomist punctures an artery instead of a vein? A. Nerve damage. B. Hematoma and excessive bleeding. C. Syncope. D. Hemolysis. Answer: B. Hematoma and excessive bleeding. Explanation: this question addresses a serious complication that can arise during venipuncture. Puncturing an artery instead of a vein is a significant complication because arterial blood is under higher pressure, leading to a much greater risk of severe bleeding and large hematoma formation, which can be painful and dangerous. An arterial puncture can often be identified by bright red, pulsating blood. For example, if arterial blood is inadvertently collected, it will spurt into the tube rather than flow. Always recognize the signs of an arterial puncture and apply firm, prolonged pressure immediately if it occurs. Question 46. For a glucose tolerance test, GTT, a baseline blood sample is collected. What instruction should be given to the patient after the baseline draw and before the next samples? A. Eat a light meal. B. Drink the glucose solution within 5 minutes. C. Engage in light exercise. D. Remain fasting and avoid strenuous activity. Answer: B. Drink the glucose solution within 5 minutes. Explanation: this question details a specific step in the glucose tolerance test, GTT, procedure, which is crucial for accurate diagnosis of diabetes. After the baseline blood sample is collected, the patient is instructed to drink a standardized glucose solution within a short time frame, usually 5 minutes. This is the load that challenges their body's ability to process glucose, and subsequent blood samples are collected at specific intervals thereafter. For example, if the patient doesn't drink the solution or takes too long, the test results will be invalid. Always ensure the patient consumes the glucose solution promptly for the test to be accurate. Question 47. What is the proper technique for drawing blood from a geriatric, elderly, patient with fragile veins? A. Use a large gauge needle for faster collection. B. Apply the tourniquet very tightly. C. Use a smaller gauge needle and apply the tourniquet loosely or not at all. D. Perform the draw quickly to minimize discomfort. Answer: C. Use a smaller gauge needle and apply the tourniquet loosely or not at all. Explanation: this question addresses adaptations for venipuncture on specific patient populations, emphasizing patient safety and comfort for the elderly. Geriatric patients often have fragile, rolling veins and thin skin, making them prone to bruising and vein collapse. Using a smaller gauge needle, e.g., 23G or 25G butterfly, and applying the tourniquet loosely, or even foregoing it if veins are prominent, minimizes trauma to these delicate vessels. For example, a tight tourniquet on an elderly patient could easily cause a hematoma or skin tearing. Always adjust your technique for fragile veins to ensure a successful and less traumatic experience. Question 48. After collecting a blood specimen for a cold agglutinin test, how should it be transported to the lab? A. In an ice slurry. B. At body temperature, 37 degrees Celsius. C. At room temperature. D. Frozen immediately. Answer: B. At body temperature, 37 degrees Celsius. Explanation: this question focuses on specific temperature requirements for special laboratory tests. Cold agglutinin tests require the specimen to be maintained at body temperature, 37 degrees Celsius, during collection and transport because cold agglutinins are antibodies that react with red blood cells at temperatures below normal body temperature, causing them to clump together. If the sample cools, these agglutinins will activate, leading to inaccurate test results. For example, the tube might be warmed in a heel warmer or carried in a thermos. Always ensure cold agglutinin specimens are kept warm to prevent false positives. Question 49. A phlebotomist notices small, red, pinpoint spots on the patient's arm after applying the tourniquet. What are these spots called, and what do they indicate? A. Petechiae, excessive tourniquet application time or pressure. B. Hematoma, a ruptured vein. C. Phlebitis, vein inflammation. D. Edema, swelling from fluid retention. Answer: A. Petechiae, excessive tourniquet application time or pressure. Explanation: this question addresses a common physical sign during venipuncture and its implication. Petechiae are small, red, pinpoint spots that appear on the skin when capillaries rupture, indicating that the tourniquet has been applied too tightly or left on for too long. While generally harmless, their appearance signals that the tourniquet should be loosened or removed immediately to prevent further capillary damage. For example, seeing petechiae means the patient has fragile capillaries, and continuing with a tight tourniquet could lead to more bruising. Always adjust the tourniquet promptly if petechiae appear. Question 50. Which of the following is the proper method for disposing of contaminated gloves? A. Place them in a regular trash can. B. Wash them with soap and water for reuse. C. Remove them by turning them inside out and dispose of them in a biohazard waste container. D. Leave them on until all paperwork is completed. Answer: C. Remove them by turning them inside out and dispose of them in a biohazard waste container. Explanation: This question pertains to essential infection control and proper waste disposal. Contaminated gloves should be removed by turning them inside out to avoid touching the contaminated exterior and then immediately disposed of in a designated biohazard waste container. This prevents the spread of pathogens and ensures safety for both healthcare workers and the environment. For example, simply tossing contaminated gloves into a regular trash can pose a significant health risk to anyone handling the waste. Always follow strict biohazard disposal protocols for all contaminated personal protective equipment.